if I were to increase this force right here, and I didn't see a requisite increase in the range of motion, that would tell me that we're at a plateau. But because we got another increase, a bump in range of motion, it tells me that we're not quite there yet.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
So good to see you again. And like I say for everyone, my main goal here is to be helpful for you. And so what can I do to be as helpful as possible for you guys today? Do you have questions? Would you like to do an assessment? What's kind of on the docket?
Yeah, so I guess what's involved with the assessment?
Yeah, so assessment can be a variety of things. Generally speaking, it is a version of evaluating how much range of motion is there, where there might be tone or some specific impairments that we can kind of tailor the Motus hand to your individual needs. So that is the sort of base level of what an assessment is. And then we also will kind of roll into potentially to modifying some individual activities, these sorts of things, kind of incorporating your preferences into what you do on a daily basis. We can also go over the donning process. I know if you have some significant spasticity, that can be challenging. So we'll go through, some alternative ways to help put the system on. But so those are kind of the main three kind of pillars of what an assessment is generally.
Okay. Yeah,
Okay.
that sounds good. We have a few questions, but should we go ahead and start with the assessment or?
Sure. Well, what we can do is we can actually go into the assessment, and then if you guys have some questions, I can start to answer them while we do this, because some of the steps will take a little bit of time to kind of go through, and we can I can answer some questions while we do that.
Okay. Yeah. I guess my first question is when it gets to her wrist extension is at about 0. Arm is completely parallel. That's about max for her currently. She can, you can go maybe a little bit past, and then it starts to get painful.
Okay.
So I'm just wondering how does the device know where to stop? Like where to.
Yeah, that's one of the most important things about doing the assessment, right? Because we can actually constrain where the device moves.
Yeah.
So whenever we jump on together, we can actually assess that whenever, hopefully that range of motion will improve as to where it is uncomfortable. And so one of the main things we do is we figure out where the ranges of motion that we can tolerate, and we won't move outside of those ranges, as well as the forces that are applied. So that's one of the main things that we do as well.
Okay.
So let's go through it right now. I saw that you had a little bit of force in there, some assistance, so I just took that out. But we'll go ahead and do our first step here. I'd actually like you guys to try to do some movement as much as you can. So we'll try to just move up and down as much as you can right now with that hand. And I also encourage you to use both hands to kind of mirror a little bit up and down. That may also help get some of that activity. And so we'll just be watching the data come through. And like I always say, there's no right or wrong answer to this. Just do the best you can. And that's what we'll go for. Good. Okay.
So go ahead. She's
good.
doing both hands right now.
Very good. Okay. Good. Okay. Good. And what we're going to do now is we're actually going to figure out kind of where we are in tone, how much tone there is. But we're actually going to do our next step is actually 3 things at once. So the first of these is actually figuring out how much sensory capabilities are there. And so we'll actually go through, and I'm going to have you close your eyes, and I want you to tell me as soon as you feel the device move you. So it's going to make a sound, but don't rely on the sound. I'm just going to gently move things up, and we're going to, I want you to tell me, you can just raise your left hand if you'd like to. Let me know as soon as you feel it move you. And I may be a little bit tricky to start with because I might move it very slowly to start with. It'll still make some sounds. I just want to see how.
You felt it move?
Yes.
Okay.
Just the sound.
Just I didn't move.
Okay.
The other thing we can look at you guys can actually watch the screen there. So that left side is the range of motion. So we're moving right now, so that's good. I think those first couple of pumps, I usually don't make it move you. Those first couple of very small increments will not actually make the device move. Okay, good. Now I just want you to relax and let me know as soon as you feel any sort of stretch in your hand. I know you mentioned that about neutral is where it becomes uncomfortable. So we'll move slowly to that point, and then we'll just assess. And if we need to stop, you guys can always stop any of the activities just by pausing the screen by touching it. Here, if for whatever reason you become uncomfortable, you can also press the 0 button in the center of the screen, the center bottom. Press that button and it will depressurize everything.
Okay.
Okay. So we'll go up nice and slow here. Rebecca, you still doing okay?
Yes.
Okay, perfect. Go up nice and slow.
How does the device, does it have sensors that just?
Yep, it does. It has sensors about the wrist and the hand that detect the range of motion. It also has a force sensor in there as well. That's detecting how much force is being applied. And as you can tell, it also has that muscle that can actually help you guys move. Okay. Still doing okay, Rebecca?
Yes.
Perfect. Okay. Okay, going up nice and slow here. Okay, so we're about neutral there, guys. We're about to 0. Still doing okay? Can we go up a little bit more, or should we hang out here?
Go more.
Going back.
Go more. Yeah.
Okay. Because we are kind of around that range, we'll go up even slower now, but I just want you to tell me if at any point you start to feel kind of some different sensations. And actually, while we're doing this, you just let me know as soon as you want to stop and we'll stop, okay? But maybe if you have any other questions, now we could take this time to ask those questions. I could try to give you an answer.
Okay. Okay, so like the data, like the results after she does a session, is there any way to like live share that with her OT?
Oh yeah, totally. The OTs can actually go on to the dashboard. I think we can probably get them access to the dashboard to see that. They also have a link to the reports that you guys have, and so we'll be sure to send that access to you guys. That way you can share with your providers.
Okay, so you'll email us, and then we can forward that to her OT, and she can kind of create an account or whatever and follow Rebecca, sort of.
Exactly. Yeah. Rebecca, still doing okay?
Yes.
Okay. Very good. So doing pretty good here. We're almost up to around 20 degrees of extension, which is good. Like I said, we're going up nice and slow. I'm not seeing any real evidence of tone here, or spasticity, that is. We're not seeing any of those sort of negative deflections, which is really good, really positive. So I don't know if you guys are able to see my screen, but what I'm looking for is as the forces are rising, spasticity would happen is if, technically speaking, the range of motion of the forces should go up together, right? But what happens is if you have spasticity, the forces will go up and my range of motion will go down. So we're looking for those deflection points where those things sort of decorrelate, if you will. And that's what's happening there is if you just imagine me moving my wrist up like this, that's me putting force into my wrist, to my hand, and I'm resisting down.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
That's the kind of thing we look for objectively in the data, but I don't see any evidence of that. And that could be because we're moving quite slow and cautiously, and that's good. But we'll keep going if you're still okay here. Kind of check out the capacities here. And the other thing we actually look for is a hard stop in the range of motion, where if we continue to put force up, and we don't see a negative deflection, but what we see is a plateau, okay? If we see a plateau, that means we're probably at the end range of motion. And all of us have this in every single joint, right? Every single joint, if I push any harder than this, unless I break something, my wrist is not going any further back this way. So we're looking for that as well. But there's a lot of safety features that are built into this to make sure that we don't put out too much force. And the ranges of motion are actually capped to make sure that we don't go beyond certain ranges of motion that are functional. So that's why the maximum angle here you'll ever see is 55. So 55 degrees of extension.
Okay.
Okay. Rebecca, still doing okay?
Yes.
Okay. So this is a little bit farther than I would have expected to go based on what you guys were telling me, but this is good.
Yeah, I mean, I guess looking at, it says 31 degrees past
Yeah.
zero. Is that what that's saying?
Yep,
I don't know, I
exactly.
just
So
wanna-
yeah, so whenever you see the positive values, those are extension values, and the negative values are flexion values.
Okay.
It's all about how you kind of measure it too, because goniometric measurements are a little bit strange when it comes to sort of wrist angles. You have to make sure you draw the right line someplace, and 30 degrees for me may not be 30 degrees for you.
Yeah, I mean,
Yeah.
I'm an engineer, and I'm looking at this, and I'm like, it looks like it's at zero right now, but that I guess you're saying
Sure.
zero is more like -15 or -20 or something. I guess
Well,
visually.
actually, yeah, could you show me real quick on your device? And I can actually pull my Motus hand out here.
Okay. I mean, I think she's holding it up.
Sure. Well, you can also just move the camera down too. That might be easier.
Okay.
I can only see you guys.
Oh, okay.
Yeah. Yeah. So what happens here is, so we're up kind of about here, right?
Okay.
And so what's the difference is when you look at, so this is neutral. And if we go up to about here, that's around 30 degrees, maybe 25 or 30
Okay.
degrees. So it's a little bit of a, that's why I said it's a little bit strange, because technically speaking, the value is going to be taken from this ulna on this side, and then actually this metacarpal right here. And so neutral actually looks like it's inflection in the device, and extension looks more like it's neutral. So yeah, it's a little bit of a, the joints here kind of obscure the true angle, just to give you guys a sense of that. But good eye there. Okay, and we can keep going, I guess, if we're doing well here. Okay, and so what else? Other questions do you guys have? How are the games going for you? We can also make adjustments on ones that are working for you and ones that aren't.
That's good.
Okay.
Okay.
Yes.
So yeah, I guess big picture, let's say 6 months to a year from now, what numbers are we looking at that to tell if things are progressing? I'm just wondering, like I guess like the assistance number and like the extension number are probably important numbers to track, I guess, right?
Exactly. Yeah. The big things that we want, and actually, let me just give you a quick insight here. This is kind of the thing that we're looking for. So if you were evaluating someone's plateau effect, if I were to increase this force right here, and I didn't see a requisite increase in the range of motion, that would tell me that we're at a plateau. But because we got another increase, a bump in range of motion, it tells me that we're not quite there yet. So that's good. Just sorry to interrupt, but yeah, what kind of things are we looking for? A couple of good indicators here. Ultimately, the goal is for that assistance value to go as low as possible.
Yeah.
The reason being is that is indicating that Rebecca's doing most of the work by herself, which is our goal. So that's what we really want. We also want to progress in the games themselves. We want to have more and more complex games, indicating some improvement in ability to do more complex tasks, right? So we want to have faster movements, and those are harder to do if you have a lot of tone and a lot of spasticity, because spasticity is by definition a velocity dependent increase in stretch or increase in resistance. And so if we can do faster movements, we've got better function. We also want that functional range, that active range of motion, to not just be flexion. We want that to be active as well, in an active extension. So those are some of the big things. I'd say we want more active range of motion. We want more precision control, but we also want that assistance value to go down as low as possible. I will say this, as we sort of progress, there's actually kind of a two-sided curve. Early on, we will often increase the force, the assistance value to help someone gain access to a larger range of motion. And then once they get access to that range of motion, we'll slowly taper away that assistance, so that way they can gain control in that range. So that you might see that value increase and then slowly decrease down. That's the kind of pattern that we'll often see.
Yeah.
Okay. Okay, good. And so what we're going to do now is I'm actually going to, are you doing okay, Rebecca? I think this is probably a good range for us to get to right here.
Yeah, I think she's kind of antsing her pants right now.
Okay. Okay. Well, let's do this. You guys can practice this. So go ahead and press the 0 button on your side.
Push the 0.
Yeah.
Bottom, middle there.
Yeah.
Go ahead. Yeah, push it. Yeah.
Yeah.
No. 0, 0. Right there. 0.
Perfect. So that's the get out of that's the bailout button. Okay.
Yeah.
So if you guys ever, yeah, exactly. If you guys ever need to use it, that's what it's there for. Okay. And similarly, in every single game, if you just press the screen, it will pause for you. Okay, and it will depressurize. But what I think I saw here is really good. So I'm actually going to cap. So this is where we can use the settings to make sure that we don't go beyond that. And so what I'm going to do is I'm actually going to cap the maximum pressure to right before we got there, we were at about 75. So now I'm going to set a global maximum of 75% assistance. So the device will never push you beyond that. Okay.
Okay.
But what we're going to do is we're going to go ahead and set some of these values here for your stretch activities, as well as your motor control activities. So I'm going to take this opportunity to make these changes here. Let's see, those should be good. And this should be good. Okay, we'll go with that and that. So we got up to around 44, almost 45 degrees. It's pretty good. Reliably down. And so Rebecca, let's go ahead and try this one more time. Go ahead and sorry about that. Go ahead and go as far down as you can for me. Press down as far as you can. Should be letting out the assistance there, and go ahead and press down as far as you can for me. Press, 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 press. Good. Minus 15, minus 20. Good. Almost there. Good. Okay. And you guys can go ahead and hit the back button for me. And I think you guys should be good to go. I'm actually making these final changes here.
Okay, so you want us to stay on the assessment screen, or you said hit the back button?
You can hit the back button. Yeah, I think so. I'm going to go, I think we're about out of time here. But I think I've got all the numbers that I need for our, for the settings. And so, like I said, I hit that maximum. So we're not going to go beyond that. I'm going to set our stretch values to fairly close to our maximum. We hit 44, 45. I'm going to keep our stretches at around 40, 42. And what we're going to do is our motor controls are going to be a little bit lower than that, a little bit sort of tighter than that. So that way we can do it repeatedly. I think we should be good. All those settings are updated on your device. And so I think you guys should be good to go from here.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.